Good evening. Welcome to The Big Question on NDTV Profit. I'm Vikram Oza. You know, for years now, many of us have done something that we don't always admit out aloud. We've typed our symptoms into ChatGPT before we've called a doctor. It's not something that we admit, but we do it a lot. Now, what does this blood test mean? Should I be worried about the number? Is this diet actually good for me? All these questions we ask ChatGPT. Now something is changing because OpenAI is formalizing that habit of ours. It has launched what they are calling ChatGPT Health. Now this is a dedicated space that doesn't just answer health questions, but it can actually look at your medical records. It can connect to wellness apps like Apple Health and MyFitnessPal, those kind of apps, and also respond with personal context. So the promise over here is simple. Help people understand their health better and play a more active role in managing it, while insisting that this is meant to support doctors and not replace doctors. The scale of this shift seems to be quite enormous. Over 230 million people already are asking health and wellness questions on ChatGPT every week. For many, it has become that first stop to decode lab reports. When you're preparing for doctor visits, you refer to ChatGPT, you plan your diets there, even compare insurance options. But here's where the questions begin. OpenAI is saying that health conversations sit in a separate, more secure universe. They're not used to train their core models, and they have enhanced privacy protections as well, is what they claim. Yet this is still some of the most sensitive data that any of us will ever share. Our medical history, our mental health, our fears as well. In India, this debate carries extra weight. We have a chronic shortage of doctors. Our healthcare access is quite patchy. There are high out-of-pocket costs that are involved when it comes to healthcare, and a growing generation that already turns to AI, not just for information, but they're turning to AI for emotional support. Many young Indians admit that they tell AI things that they would not tell another person, even as they worry about becoming more isolated. So now the question is AI stepping into a domain, healthcare as such, which is, of course, something that we've treated differently in the past. Now, is there going to be that much more focus on what AI can bring to the table? And that's what we're discussing to the panel. Would you trust AI with your health? Let's ask our panel, and let me introduce you to them. Joining us on this discussion is Miki Mehta, holistic health guru, joining us with Dr. Ashutosh Tiwari, the senior consultant, critical medicine at Regency Hospital. Mehzabeen Dordi is also with us. She's a clinical psychologist at Sir H.N. Reliance Foundation Hospital. Ritesh Bhatia is a cyber expert, and Arpit Agarwal is investment partner with Bloom Ventures. Thank you all for joining us and making the time for this important discussion. Now that this question has come up, it's important to ask, and let me begin by asking Dr. Tiwari. I remember just a year ago reading this report where a pregnant woman in the US said that ChatGPT actually flagged a life-threatening condition for her, and it saved not just her life, but that of her baby as well. And this was about a year ago, maybe even less than that. But also in a poll that we've conducted here on NDTV Profit social handles, you're seeing over there more than 61% are saying that they already ask AI health-related questions. So I want to ask you, as a critical care specialist yourself, how are you seeing AI's role in healthcare today?
Very good evening to all of you. And this is Dr. Ashutosh. A very valid question has been raised by the team. And I would like to say that people nowadays are using AI and chat GPTs for coming to any conclusion of their health reports, including even minor ailments. And the example which you have given is well known to everybody. But to add to this fact, I would like to say that AI or a chat GPT is not a conclusive tool. It may help you to narrow down your diagnosis. It may help you to come to from a broad spectrum to a narrow spectrum, but it cannot give you exact treatment. For treatment, you always need to have a consultation with your doctor, because it cannot conclude. It can just guide you. The example which you have given is very known, but I would like to add a new example to the ongoing debate. A lady came to us 2 days back and she was bleeding from her nose, and she was a known case of cardiac disorder, and she was an antiplatelet, and the PTCA, the angioplasty, was done few days back. Ideally, it should have been continued on dual antiplatelet, but Because of the bleeding, we have stopped. But if such a question will be asked to Chat GPT or AI, they would say, no, no, if the angiography and angioplasty has been done, then the dual antiplatelet should be continued. Having said that, what I want to convey is the decision should be as per the specialist, not as per the Chat GPT or AI. So you can use Chat GPT and AI for taking help, but not coming to a conclusion.
So that is the situation today, doctor, and we are seeing that change very dramatically with all the strides that AI is making, which is why I want to turn to Mickey Mehta. If you consider holistic health, there are tools, and you're seeing them as empowering. At least to some, it is empowering. ChatGPT Health would hope it is to individuals to take charge of their well-being. How do you see it as a holistic health guru?
So medical care is very different from healthcare. We always tend to mix up healthcare with medical care. Healthcare is all about healing and wholeness, and it is about therapies. Therapies are very customized, individualized, and personalized. We understand that health and healing has to be done in a way which is very specific to your constitution. So, individualistic constitution, individualistic biology, and very, very important that it has to be very personality driven, which means that what's your personality like? Are you the angry kind? Are you the energetic kind? Are you the lethargic kind? Are you the sulking kind, the depressed kind? And accordingly, we give therapies. Now, to seek medical options for knee surgeries, it's good to have a chat GPT. But to have options to recover post-surgery, chat GPT may not be the best bet because you might lose out on the best of the best understanding of a face-to-face consultation with an understanding of the persona, lifestyle, environment, objectives, medical concerns, so many things put together. So best is...
Yes.
Sorry.
No, but Mickey, this entire debate about outsourcing perhaps intuition or self-awareness to AI, some would argue that it weakens the mind-body connection. You're saying that this doesn't help to push them into better health, even if it is something that AI is suggesting that perhaps you need to have a holistic health consultant to go to be able to get a better mind-body connection.
100%, because a face-to-face, emotions to emotions, prefrontal cortex consonance, resonance, coherence of two beings gives birth to solutions. You just cannot have solutions as a formula because AI depends on statistics and life is beyond statistics and data. Individualistic health cannot depend on the statistics of generalized understanding of the medical science.
Okay, fair enough. That point is well taken. Ritesh Bhatia, now this ChatGPT Health that we are talking about, they are claiming that medical data is sitting in this separate, secure space. It's not being used to train core models for AI. From a cyber perspective, from a data security standpoint, is that kind of assurance strong enough, you think, for health data? Can we really believe these safeguards?
Not at all. Vikram, not at all. We've also seen the kind of breaches that have happened with OpenAI earlier also. And with this kind of over-reliance, on AI platforms, whether it is OpenAI, whether it is Grok or anything, I think, we are just risking out a lot over here in the name of convenience. As far as when you're talking about security, no security is foolproof, no security is enough. And let's not forget, Vikram, we are talking about over here is something that is like a personal health information. This is the most sensitive information. And, the drug makers, all the pharma companies and everybody would be like wanting to have this data as such. So what is the assurance that this data won't be sold, for marketing or something like else, for some sort of research to these pharma companies? What happens when it gets breached? Well, they're talking about encryption and all, but then, there needs to be something as such. But most importantly are two most important factors for me over here. One is data hallucination. So what is data hallucination in AI? When AI says, okay, this is what it is, and you tend to believe it, that is hallucination. Because that is not correct. And in such a short period of time, they've just contacted they had some 260 physicians on board to help them with this particular thing. So this data hallucination is bound to be over there. And the kind of trust that we have on the chat GPT nowadays, so we are going to say, okay, if this is what it is, if it is saying that, okay, I need to, like, let's say, have methi seeds in the morning to reduce my sugar, and maybe even if it's a fact, but if it starts giving you certain other kind of information, and you will start believing it, and that is what is data hallucination. The second most important thing is about the data bias. Now, what may work for the Western people may not work for the Eastern people. What may work for the people who are there, like, let's say, in the cold countries, may not work for things in the, southern countries. So there could be a lot of such biases. But overall, from the cyber perspective, if you ask me, even from the data privacy point of view, I think it's like a big no-no.
Mezzabeen, where do you stand on this? Because this is a question of trust, whether there are privacy issues or whether you can rely on the kind of advice that comes through AI, which Mickey Mehta is saying is all driven by algorithms. You're talking about statistics over here. There is medical healthcare. You have mental health over here, and that's your space. It's rapidly growing. And our poll is actually showing that 44%, all of them, 44% are saying that they would trust ChatGPT Health only if a doctor is involved. So that's an important statistic to bear in mind. When AI begins to mediate into emotional and mental health conversations, where do you see the risk, the biggest psychological risks over here?
I think first and foremost, the biggest, most important factor for us to consider is that psychologically speaking, trust needs to be on a spectrum, which is often shaped by fear, uncertainty, urgency, and perceived authority. A lot of times, what is said with sheer confidence is taken at face value, and that's what ChatGPT often is been doing. Now, ChatGPT doesn't have any ethical duty of care, it doesn't have any legal responsibility towards the client or any actual clinical risk assessment. When we are in a therapeutic setup, what happens is that there is so much more that goes on beyond just the conversation. There are personal cues, there are interpersonal dynamics, there are ways, tones, intonations, which we pay attention to. Body language plays a big role. All of those factors are completely ignored when we are talking to an AI bot. And that becomes a very big lacuna. That becomes a very big area where it's actually not paying attention. So that is why, from a psychological standpoint, from a health perspective, from a mental health perspective rather, it's good to use ChatGPT, to use it for information, to organize some data, and for some degree of support. But when we're looking at diagnosis, when we're looking at treatment, or when we're looking at actual responsibility for a condition and for treatment, I think it's an absolute no-no. That needs to be left to the professional healthcare providers itself.
Which is what a majority of you are saying. Arpit Agarwal, now you weigh in on this on the business perspective, because now you're seeing ChatGPT Health come in. There is personalized healthcare, and it's happening at scale. So what do you think is going to happen to the smaller health tech, the smaller wellness apps? Do they need to fundamentally recalibrate their business models now at this stage?
See, what is like... Thank you for having me on the panel. And I agree with most of the comments made about the technology itself, Yutesh, Dr. Tiwari, and Mezzabeen. The challenge is each company, when they are bringing a new product to the market, will need to show differentiation. And if the base model is built by a large company like an OpenAI, ChatGPT, you will have not much differentiation to be built. However, if you are looking at tiny slices of the data, for example, someone looking at women healthcare, or mental health, or chronic diseases from an Indian context, there is a lot of contextual information that can be piled on to the simple base models that are available out there. All of this put together create a unique differentiation that one can expect from a company, from a healthcare service, which is also very targeted and accurate. The challenge, as Hannah has already pointed out, is hallucination. Information cannot be relied upon. Even Google cannot be relied upon with the information, and ChatGPT only accentuates it because that's the nature of the beast. It is not accurate. It's not meant to be that way. And hence, it doesn't replace, and it says so in the disclaimers, unfortunately, it doesn't stop people from believing in it, that it doesn't replace an actual physician. Correct. And the advice the physician would actually give you. Yes. I don't believe that it automatically takes the advantage of smaller companies away.
Okay.
At the same time, the companies will have to work around this elephant in the room.
So how they're going to work next, Arpit, is going to be an important ask. So you think businesses will need to be realigned with how OpenAI is going to treat ChatGPT Health and the size and scale that it grows to?
Yes, and every business actually will have to realign, because this is now the baseline. Whatever you could do earlier on a chatbot can now be done on ChatGPT from scratch. You could have taken 2 years to get there,
Correct.
but now it is off the bat. So a lot more work will need to be done in contextualizing it, in making it narrower, making it more accurate, and making it available in a business model, plus distribution, which continues to be a challenge. I don't think ChatGPT automatically will get adopted by enterprises or consumers alike. There's a lot of work that can happen on these platforms. However, are we going to replace the platform? I suspect not. We will have to find a way to work around it.
So working around it, now questions have been raised about accuracy, Dr. Tiwari, and OpenAI by themselves are insisting that ChatGPT Health is not for diagnosis, that it's not for treatment, it's only meant for interpretation and preparation. Would you concede that they do a good job of that or not? Yet nearly we are looking at these respondents in our own poll, they are already trusting AI tools for a first opinion, a good majority of them. So in real world practice, if I were to ask you, is that distinction meaningful, or do you think it dangerously blurs things for patients when they're looking for that, even that first interpretation or prepping for a visit to the doctor? Are they doing it well, or do you think that they're not really painting the real picture, as it were, of what they can offer patients?
Well, Vikram, I would like to add that the information which is given by ChatGPT and AI are helpful, but many a times the people who are using it doesn't universally apply to everybody. For example, one of my panel member told that the information is generalized for all the countries all around, but it cannot be hold true for every person around. For example, if you talk about the BMI, now in India, the average BMI and the definition of obesity is different from what we get in the Western countries. So ChatGPT, AI, they will definitely help you, but they cannot help you in treating. They cannot help you in rehabilitation. Moreover, there is something called as empathy, touch of the doctor. So you won't be feeling satisfied until unless you have not walked inside the OPD, you have not been like given attention by your physician, you have not been touched, your problem has not been treated adequately, and you have not been given time. For example, I'll give you a very good example which recently has happened in my OPD. A patient came with a pain abdomen and he was searching what are the reasons for pain abdomen, and the first thing which was shown was a cancer, and that has created apprehension in the mind of the patient. And then that lady became very panicked. She came to my OPD, and after like initial evaluation, it was a simple stone. My point is, you can use AI chat GPT for having a very good inquisitive status of your disease, but you cannot decide, you cannot treat based upon just the symptoms. So you have to go to a physician, to a specialist for narrowing down your problems and getting it treated in a nicer way.
So you don't have a fundamental problem about patients using AI to understand their situation, as it were, or getting more information about their situation after they've consulted with a medical professional like yourself. Ritesh Bhatia, when you're talking about people uploading all this long-term medical history, their lifestyle data, when you talk about the risks involved in this, what are they? When it comes to secondary use, perhaps with insurers, with employers, with future policy changes as well, do you think these privacy promises that are being made today, those can be challenged and those risks stand? What exactly do you see as risks there?
Yeah, Vikram, as I told you earlier also, the risk is like, this is the kind of data, even as, when they are saying it is going to be encrypted, which it may be encrypted, but we've already seen many breaches happening. You also spoke about those insurers and, other kind of people who are going to do it. As I told you earlier also, so just imagine the insurer, he getting hold of a lot of data. Like I am diabetic. So, I was testing out ChatGPT and I was testing out 3 other different platforms like Grok, Perplexity and other kind of things. Now this data goes out out over there. Dr. Tiwari was talking about, like, when you ask the question, can I just give my reports over there? So we are actually telling them that these are the diseases we have. And once that is there, with these particular people, it can be like, misused in a variety of ways. Like for example, the insurance companies coming to know what are the kind of diseases we have, because we don't disclose everything to them. Secondly, it could also be like now these particular pharma companies understanding, okay, these are the majority risk. Now the thing is, Vikram, I have not given my consent for this.
Sure.
And when these guys talk about security and privacy, I think that's just on papers. It's just not proved over there that this is how it is as such private. And most importantly, what are the data sets that you have used as such?
Yeah.
So now you're building the data sets using our data. Vikram.
Yes, indeed. So now that we're talking about how far this can go, the risks that are involved, Mickey, I want to ask you, because in India, we have specific kind of challenges. There are gaps in access when it comes to healthcare. Affordability is an issue. There is preventive care, of course. But do you see AI as a bridge, at least, that in some way democratizes health knowledge, or even a shortcut that risks superficial solutions to deep health problems that people may have? Between those two, where do you think India is going to be able to capitalize on what AI brings to the table for healthcare?
I think allowing good options for access to medical science and to understand what is prevalent today in the modern medical science frontiers. Number two, what is most important is that if some doctor tells you to walk a certain path for a certain treatment, you can go to AI and begin to understand and have a broader perspective of that, because doctors generally don't give you more than 10, 15 to 20 minutes. So at least you can read up a lot. So let's say a doctor tells you you got to do angioplasty. Let's say a doctor tells you you got to put up some stents, and many a times these are not required. So you can certainly access AI to broaden your perspective and understand. Of course, you will take second, third, fourth opinion, but AI gives you a very comfortable, deep dive inside for you to have some knowledge and information. So this is all one can do. Now, you gave an example earlier.
Yes.
That one lady saved her life.
Yes.
But at the other hand, there could be hundreds of lives at stake using AI.
Sure, and those are the risks, yes. But Arpit,
so let's not glorify that one life.
Let's not glorify that one incident. So the anecdotal evidence that is being cited in favor of AI, you're saying we should not mistake that for a holistic, a more universal picture on how AI can tackle healthcare in the future. But Arpit, then how should we look AI in healthcare? Should we treat it like a regulated medical device? Should we look at it as a consumer tech product? Or do you think it should be treated as something entirely new? How do you think we should look at it?
See, healthcare is a trust business. If I go to a Dr. Tiwari and Dr. Tiwari does well, it is baseline. But if Dr. Tiwari does not do well, then I can hold him or his organization to task. And that is how trust gets built. There is a full governing mechanism on healthcare. If I'm trusting someone's advice, they should be held responsible. The challenge with any ChatGPT or GenAI or even Google for that matter is that it is not responsible. The loop is not closed. The feedback loop has to be closed. And until that happens, one cannot replace real doctors, people who are building reputation over decades actually, and institutions get built over a period of time. Until that happens, it can only be an allied use case where you can say, I have this, give me more information, help me learn better, as Mickey is already saying. Or you can say, I have this indication, tell me what are the possible solutions, and that helps you educate yourself better. So more than that, I don't think you can replace real people or hospitals or doctors.
Yes, but the real point that you're making is about accountability. When AI advice goes wrong, where should the buck stop?
Yes. And the challenge is, if you go to a hospital, the accountability is already taken care of.
Yes.
And hence hospitals are not going out of fashion. The challenge is, I wish I could just use this as a magic wand and give it to rural areas where there are not enough doctors. Unfortunately, the advice is not 100% reliable as yet.
Right.
It may get there in 2-3 years,
Yes.
but it is not there as yet. And until that happens, one should take it take it very slow.
So here's what this debate is telling us. AI in healthcare is no longer this idea of the future. It's already shaping how people understand symptoms and mental health as well. Medical choices are being made. It can inform, it can assist, it can sometimes alert as well. But like everyone over here is saying, it cannot replace clinical judgment, not even human empathy, or for that matter, accountability. In fact, our poll is reflecting the kind of tension that exists over here. Many people already turn to AI for health queries, yet most are still keen on the involvement of a doctor. And that's evident. That may be the balance as of now. AI as a tool, but not as a substitute. My thanks to our panel, Mickey Mehta, Dr. Ashutosh Tiwari, Mezabeen Dordi, Ritesh Bhatia, Arpit Agarwal. Thank you so much for joining us with your insights. And that's about all we could pack into this edition of The Big Question. Of course, the important questions keep rising, and we're going to keep finding you the answers. I'm Vikram Oza from me and the team. Thank you so much for joining us on NDTV Profit. Good evening.